So guys, I just got back from a really amazing research trip, and in today's video what we want to do is I just want to take you through the video and explain what we've been doing. And in essence, it's all about impact research. How can you do amazing research that has real benefits for society when you do it? If you're thinking about impact research, it's really about how you go about assessing the impact of some of the new policy initiatives, interventions, training programs that you implement within a particular society. And so today what I want to do is just give you some overview about the two types of impact research that I'm going to be doing over the next 2 years. So don't forget, subscribe, and let's keep going. Okay guys, so as you know, research is my thing. There are lots of ways in which you can do research out there, but I like to focus on impact research. The reason why I like that is because I know it's going to have some type of real world benefits. So if you're thinking about impact research within the healthcare context, it is really about how you evaluate a lot of the key initiatives that you're trying to implement. It might even be in clinics, in hospitals, in pharmacies, any healthcare organization. So you can do it at the individual, at the organizational, or also at the national level. It really depends on what you're trying to do. And there are loads of benefits of doing impact research. You can think about allocating of resources. You can think about perhaps if you want to prevent disease, if you want to upskill your workforce. And basically, if you just want to know what is going on in your local healthcare ecosystem. So the list of benefits of doing impact research is actually endless. So I'm not going to go through all of them. We don't have time for that. In today's video, we're going to be thinking about two of the ways in which I'm doing impact at the moment. So the first way I'm doing impact at the moment is through my healthcare digitalization impact training. So in essence, what happened was last year I developed my research framework. And in addition to that, we also, after we conducted the research and analyzed the results, we thought, let's develop a training session for healthcare workers. So that's what we did. And to make it really cool, we adapted the training to each different healthcare group. So if we had doctors, we adapted it. If we had nurses, we did it in a specifically different way. If we had managers, we also changed it. So the context specificity of the research that we did, I think, was one of the most amazing parts of it. So we finished the research, we got all the healthcare professionals doing case studies and all sorts of crazy stuff, right? At the end, then we collected data. So we did it using Qualtrics. Some of you might know that. It's a really, really good tool for doing impact research. And at the end of the night, I thought to myself, wow, no, this was probably the second night of doing the research. I called up some local guy and he took me around the whole city and we went everywhere. We went to the top of the mountain. The views were absolutely amazing. And I remember, okay, then whenever I'm doing research, whenever I'm out in the field, I have to make time to also take in the local ecosystem. There's no point going somewhere new, doing research and then leaving. You have to take it all in. So the second way that I'm doing my impact research is through policy development. So once we finish the first point, which is around sort of training healthcare workers, we're going to use all of that data and we're going to work with healthcare organizations, both public and private healthcare organizations. And in essence, we want to co-create a new healthcare digitalization policy document. Now, I have really, really big hopes for this document, and it's really about getting healthcare workers to know the importance of healthcare digitalization and to think, okay, then how can we at the individual organizational level work together to actually implement and to utilize all of the really good tech that's out there around healthcare digitalization. Now, it's really important to note that good quality policies equals impact, right? So if you can develop really cool policy initiatives for your local healthcare organization, if they're implemented and acted upon, then just imagine the impact you can have. And to be honest with you guys, that is what motivates me. That's what keeps me going, knowing that whatever research I'm doing is actually going to have an impact on the ground. And that, although we've only talked about 2 impact researches, there are so many ways in which you can get involved. There's so many ways in which you can do impact research in your local healthcare community. So get to it. Okay guys, thank you so much for tuning in to another episode of Leading Health. Don't forget to connect, engage and explore. Let's keep it going. Thank you for connecting and stay interconnected.